I'll let everyone find a comfortable seat. That can be any comfortable seat if you want to sit on the ground, on your mat, in a chair, on your bed. And once you're there, I invite you to close your eyes, roll your shoulders back and down your spine, let your elbows hang. Your hands can rest on your knees or your thighs. And just notice your breath. Without changing anything, allow your body to breathe itself. Notice whether your breathing is maybe a little shallow, or maybe you're taking long, slow, deep breaths in and long, slow, deep breaths out. Bring your awareness to your neck. See if you can feel your hair on your neck or your clothes on your skin, around your neck, and your shoulders. And then see if you can bring your awareness just a little bit deeper, just underneath your skin. How's your neck feeling? Maybe you have pain in your neck this morning. Start to bring your left ear towards your left shoulder. Keep your shoulder where it is. Just bringing the left ear towards the left shoulder. And notice what that movement does to your neck. Bring your head back up through center. And the right ear towards the right shoulder. Again, keep the shoulders relaxed away from the ears. And continue to go back and forth like this slowly. Find that movement. And really focus on how your neck feels this morning. As you bring this gentle movement into it. When you are on a side again, you can start to actually roll the head down, bring the chin towards the chest, and then roll the head over to the other side. And just go back and forth like this now. Instead of side to side, or rolling the head down through center, chin to chest, and then bringing the head over. And really focus on the places where you feel the tension as you do this. You can also start to lean the head back as you go from side to side. So you're almost completing a circle and coming back down. So you're starting to stretch into the front of the neck. And see how slowly you can make this movement. See if you can imagine every fiber of your muscles getting stretched out one by one as you slowly move from one side to the other. And then let's come back to center, bring the head back up. And bring your awareness again back to the skin of your neck, where your hair is touching or your clothes are touching. And then again, a little bit deeper down to your fascia, your muscles. And notice if anything has changed. I notice it feels a little warmer. There's a little more circulation or blood flow. Let's bring our hands together in front of us, and you can start to rub them together to find some friction, create some heat. And then place your hands on the back of your neck and around the sides. And if you press your fingertips, if your hands have met in the middle and you press them down right in the middle, not too hard because your spine is right there, so it might hurt if you do it too much. But just enough so that you can feel the spine on your vertebrae, your cervical vertebrae, the vertebrae in your neck. And then just off that, if you bring your fingers just to the side of your spine. If this is your spine in the middle, your fingers are just off to the side. And then you kind of cup your hands like this and use your fingertips and the weight of your arms just off the side to kind of dig in right off the side of your spine. And then allow the weight of your arms to slowly bring your hands farther and farther apart on your neck, dragging them down and around your neck. You can go all the way down. And as you're doing this, it's kind of a diagonal line, really. You're not coming all the way forward here. Because if you come all the way forward here, you're gonna run into your jugular, and you don't want to run into that. So it's more of a down and around motion. And you can pause in any spots that feel like they might need a little extra attention, a little extra awareness. For me, that is just in my scalenes here. That's on the side of the neck, just in here. And that is actually where you have some nerves and some veins and arteries that run through right through your scalenes. If these are too tight, it can start to affect your shoulders, your arms, your hands, your wrists. So it's nice to get in here sometimes and just massage a little bit. You can even do 2-finger circles right in here. And this also helps your lymph flow. You have some lymph ducts right in here. This helps move that lymph out. You can do little circles over your collarbones. Just help move the fascia, stretch it. You can always do this one hand at a time. Sometimes it's a little easier to do cross body. So if you use your right hand on your left side, you can also uh, prop your right elbow on top of your left arm if that is helpful. And your scalenes actually go all the way down and attach underneath of your collarbone onto your rib cage. So if you are massaging on the left side and you keep your fingers just on top of your collarbone, and then you tilt your head to the left, so you're bringing that left ear towards the left shoulder. You can kind of go underneath your collarbone there to try and get into some of those attachments. Obviously, if it hurts, go to your comfort level. And it's nice to be able to massage yourself because you know what your preferred pressure is. You can just go to that preferred pressure. So another thing I like to do is press down in one spot and just kind of pull the fascia around with my hand. So my hand isn't it's not moving like this. It's pulling the fascia around. See how that moves my hand, my fingers are moving the fascia around. You can even see it in my neck too. So you can see, because my fascia is fairly tight. So you can really see it move. And that's what you're looking for. You can add a little bit of a stretch into this. You want to stretch your head away from the way direction you're pulling. It's a little bit of a pin and stretch. You can even Bring your head down to the side, then pull and pin, and then move your head. So that's left ear to the left shoulder, hand comes down just underneath the collarbone here, pulls the fascia down, and then start to bring the right ear towards the right shoulder. Do that again. It's really nice if you can do it on your SCM, which is this muscle that really pops out here, your sternocleidomastoid. So it attaches right here on your collarbone. You can, the knobby part of your collarbone, if you pull right down there and you bring your chin towards your chest and then start to look up, bring your chin towards the ceiling. It's a nice little pin and stretch. That's what this technique is called, because you're pinning the muscle down in one spot and then stretching it in the other. Start to do the right side as well. So you can start with little circles or however feels best to you this morning, however you want to start. And we can start to drag that fascia around underneath the collarbone. And maybe you'll notice as you're massaging your own neck that you maybe hit a spot where it feels pretty tender, and you can also feel that spot somewhere else in your body. Like for me, I've got a spot kind of right in here where I can press and it feels pretty tender where I'm pressing, but I can also feel that right up in here in my neck. I can feel a little bit of just kind of a warmth or an awareness. Sometimes it also feels like a pain. Sometimes it feels like tingling. And that is called a trigger point. So if you've ever heard of trigger point therapy, that is what that therapy works with, is those spots in your body. I'm going to start doing that pin and stretch again. So we're going to bring the right ear towards the right shoulder. Bring the hands just underneath the collarbone. Pin and pull down. And then we're going to bring the left ear towards the left shoulder. Or stretch. So you come down. Right ear towards the right shoulder. Pin the fascia down. Left ear towards left shoulder to stretch. And then we'll do the same for our right SCM. So find the knobby part of your collarbone. And sometimes it's even attaching right in the middle here on your sternum, which is why it's called the sternocleidomastoid. But I can actually feel when I get like on the really when I get on the main part of the attachment site, I can feel it already going all the way up into my neck here. So if you can feel that, You can, and even if you can't, you can just know that, I mean, you can even turn your head to the opposite direction, and you can, if you bring your fingers to that knobby part and your sternum, which is the middle, your breastbone, where those two bones meet, right here. If you turn your head to the right, you can feel that tendon of the sternocleidomastoid pop out underneath your fingers. And that is where you can bring your head back to center, pull down right there, bring your chin to your chest, then pin and pull down. And then slowly, slowly lift your head, raise your chin towards your chest or toward the sky. You see the ceiling. And then I think it's nice to just kind of flush that area out, do some nice light strokes, a little more fat or lymph. Your lymph is really light in the skin, so if you just have nice little light touches, you can bring the hands up the face, into the skull, give yourself a little head massage. Into your hair. And then take a long, slow, deep breath in and out. You can close your eyes. Again, bring awareness to your neck. Let's do that movement we started with. So we'll bring left ear towards left shoulder. Back through center, right ear towards right shoulder. Back through center. One more time. Left ear towards left shoulder. And right ear towards right shoulder. Back to center. Notice if there's any difference here in your neck. Bring chin to the chest. Notice if there's any difference there. And head back up to center. Bring your hands to heart center. I just want to thank you for allowing me to lead you through this short little neck and head practice today. And I hope that it helped release some things for you. From my heart to yours. Thank you.